Good afternoon. Hi, everyone. I'm Andrea Bonacci, Director of Population Health Programs with AHI. Welcome to the 2021 North Country Leadership Summit, Emerging from a Year of Change, an Opportunity to Rebuild and Reimagine. The summit is being brought to you today by Adirondack Health Institute and Fort Drum Regional Health Planning Organization. Would like to thank all of our generous sponsors who have supported the summit this year and allowed us to be here today. A few housekeeping items before we get started. First, I just do want to remind everyone that summit presentations are being held daily through the remainder of the week, 10 a.m., noon, and 2 p.m. So we have many more great presentations scheduled. If you haven't already looked at the rest of the week, please do so and feel free to sign up. All questions and comments should be entered into the chat box, and we will ensure that your questions are answered during Q&A session at the end of the presentation. All attendees will remain muted with their videos off during the presentation to ensure best broadband connectivity. I'll also mention that depending on the storm that's coming in and internet connection, that our presenters may turn their videos off as well. And the presentations are all being recorded and will be archived on the North Country Leadership Summit webpage that will be available by October 1st. So our last presentation of the day, I'd like to introduce to you our presenters from Alliance for Better Health. We have Kashana Owens-Cody, and she's the Senior Director of Community Empowerment, and Julie Adamick, the Director of Strategic Partnerships, and they will be presenting on social care integration into healthcare delivery systems. So Kashana and Julie, I will hand it over to you, and everyone enjoy.
Hello, everybody. My name is Kishana Owens-Cody. I'm the Senior Director of Community Empowerment here at Alliance for Better Health. And I'm joined here by my colleague, and I'll let her introduce herself.
Hi, my name is Julie Adamack, and I'm the Director for Strategic Partnerships at Healthy Alliance.
So today we're here to talk to you all about Healthy Alliance IPA. And before we got started, what we were hoping to do is get a feel for who's actually here in this space today. We recognize there's a lot of participants from a lot of different organizations and industries. So we're hoping that in the chat, you can share with us if number one, you click one or type in one if you represent a community-based organization. Type in number two if you're a health system, three if you're a health plan, four if you're a pharmacy, five if you represent the behavioral health, mental health, substance use space, and number six if it's other. But we're curious who's inside of the space today. And then Andrew, when you get a chance, share with us where you see maybe the most representation.
So I'm seeing primarily community-based organizations and health systems. We also have behavioral health organization and other. And that's about it right now.
Great, great. Well, I love that there's a great mix of organizations because as we'll talk about, this is what makes actually a really good, healthy and high performing network. So it's great that we have lots of different representation across the spectrum. We hope you're enjoying the conference so far. We hope that there's some key takeaways that you'll be able to take from us as well. So Healthy Alliance IPA, many of you may recognize Alliance for Better Health as a performing provider system in our district stage, and we were one of the 25, but we also have formed Healthy Alliance IPA because we recognized that there was a gap in terms of supporting social care organizations and engaging with health plans and health systems in terms of, many of you may have participated in lots of different projects in district. But this is the gap that we hope to step into and to support our community-based organizations in contracting with MCOs. So our network is one of the first IPAs in the country that is actually focused on social care providers. We have a very high performing network of organizations providing social care services. And when we say social care services, This includes organizations that may be addressing food insecurity, homelessness, benefits navigation, but also our behavioral health providers as well. And we believe at Alliance that investing in social needs before they turn into costly medical problems creates better health for all. So we're really focused on upstream activity and really supporting our consumers in the community and having better health for all. So how do we do this? We can only manage what we can measure, right? So we recognize that social care and medical care is what actually equals healthcare. We also recognize that, healthcare is not just, physical health. And a lot of you probably have seen this picture throughout our career so far in terms of healthcare, and recognize that, 20% of healthcare is really your physical health. But we recognize that social determinants of health, so community safety, income, education, physical environment, all of those things also impact our health. So what we've incorporated is a social determinants of health screening tool. I'm going to blow this a little bit up so that you can actually see the full picture. So our social determinants of health screening tool, we created this tool actually in one of our former district projects where we pulled lots of partners that were engaged in this activity and created these different questions to really get a gauge of, what are some other underlying needs that may need to be addressed as we're also looking at physical health. That space included community-based organizations, health system, behavioral health providers inside of the same space. And this is what we use to gauge what different social determinants of health needs one may have that we can also address through our Healthy Together system. So before we move any movement forward, we're curious, how many of you are actually screening for social determinants of health at your respective organizations? So you can type in yes or type in no or not at this time, because some of you may be in development, but we're curious how many of you in this space are doing that. So Andrew, we'll look to you to give us that gauge again if you.
Yes, so far everyone is saying yes. We've got about 7 responses saying yes, and 1 who responded with no.
Awesome. Well, that's great because the social determinants of health screening tool can give us a lot of information. One, we know, what referral connections we need to make. You can also assess for different gaps in the community that you may see and maybe some additional partners you want to bring into your network. But that's really good that a lot of you are already screening for social determinants of health. So what Alliance is up to right now as well with the Healthy Alliance IPA is that we want to leverage our lessons learned. We've learned a lot so far over the past 2 years of being an IPA in terms of engaging with health systems, engaging in contract activity with managed care organizations, establishing our closed loop referral system. As many of you know or may know, we're using Unite Us to really pull our partners together in a closed loop referral system. And Julie will talk a little bit more about that, so I don't want to jump too far in. But we have a lot of experience in that space and have grown tremendously over time using Unite Us and Healthy Together. That's what we call it in our area. We've definitely strengthened our referral network and came up with amazing performance standards that support our partners in really meeting our community's needs in real time. We've also grown sophisticatedly in terms of collecting social care intervention data. And we're working together to demonstrate how social care definitely improves the health and well-being of our consumers. So we're here to be a resource. This is actually playing right into why we wanted to definitely participate in this conference, is to share our lessons learned and to support others as they're growing in this journey of integrating social care with health systems. So at this time, I'm going to pass it over to Julie.
Thank you so much, Kashana, and I'm very excited to continue on with the conversation. If we could go to the next slide. So as Kashana mentioned, really it all begins with completing that social determinants of health screening. And really, I have to say that in my years of experience in healthcare, I worked in a health system, I've worked in a hospital system, and I've worked with an MCO. And really, I can tell you that the biggest component or kind of barrier in having discussions is really just time. And often folks have the ability to do the depression screening, but don't always get to that social determinants of health screening. And really that addresses whole person care, which Kashana was speaking about in an earlier slide. So the hope is, and it's great to hear that most of you are doing the social determinants of health screening, is once that screening is done, any positive findings, would be referred into the Unite Us platform, or as Kashana mentioned, Unite Us platform, we call it Healthy Together in this area. So really making that connection and making that referral in the Unite Us platform, because that kind of puts it in process, if you will. It really kind of starts the notion that this referral is needed, and now it will be in a closed loop system to make sure that that referral is taken care of and that individual gets what they need. The goal is to really create an organizational structure that really supports everyone. Really, we want to make sure that the needs of the community are really reflected, and define and execute services that managed care wants to pay for. So what does that look like for managed care? Once we have the referrals and we can share and look at the data, what does that look like in your community? Does that look like we need additional programs for food insecurity? Does that mean we need something in line for housing or transportation? But this gives us the ability to really look at that information. And then really, it's about sustainability and growing a funded program to support social care programs through the IPA. And I really will say that data does tell the story of your community. Kashana, the next slide. Thank you. So in our participants in the IPA, we have about 90 at the moment, and we're always looking to enhance our participants' participation and our partners. So we really have 90 that's grown over time, and we're continuously growing and looking for opportunities, talking to our partners, seeing where there's gaps, how can we fill those gaps, and what does that look like? And I think we've been very successful in that arena. So if we look at our network impact beginning in 2018, we have 23,213 unique service episodes. Now, I've worked in healthcare a long time, and in the day, and I'm aging myself and I'm embarrassed to do so, but in the day, I would not have been able to tell that, because what we used was a directory, a paper directory where we made referrals. So to have the ability to know that there was 23,213 unique service episodes is absolutely wonderful. Further, you can, based on the data, you can tell that over 12,000 clients have been served. What really is wonderful is that there's over 2,500 network users that are using Healthy Together every day. So there's over 2,500. And in the Capital Region, there's 471 organizations onboarded and 945 programs, and we're continuously growing. So based on what I had just spoken about what programs are needed, and based on what your community looks like, or the needs of your community, through the Unite Us platform or Healthy Together, it really can drill down and look at what are the top concerns. In this case, January through March 2021, physical health, food assistance, benefits navigation, housing and shelter, clothing and household, and so on. The part that's really important, and equally as important as what services are needed, are what is being resolved, what is still open, and what is not resolved. So when a referral is made, we really can understand, here's this referral that was made for an individual. It was for food assistance. We can track that all the way through to make sure that that individual gets the food that they need. We mark it as resolved. If it remains open, we really follow that to understand why it's open. And if it's not resolved, we really go back to the organization and talk about why it's not resolved. In some cases, it may just be a bad phone number, or we're not able to get in touch with them, but we really can track and trend that data. So we really have network standards and guidelines that tell us we want to be at X% to make sure it's closed, and we do our best to get there and really work with our partners to make sure that we achieve those goals. Working at Healthy Alliance, it's wonderful to have the opportunities to still be in touch with our MCOs and really work with programs that really speak to what the community needs are. It really is that continuum of care. We've worked with CDPHP in a couple different ways. The first way was a 3-year contract for food insecurity. And that was really a service, three levels of service, including Food Pantry Plus, medically tailored food pantry, and healthy prepared meals. Also, we had a transportation for social isolation program with CDPHP. The second program was a wonderful, collaboration, if you will, where CDPHP worked with Healthy Alliance and made a contribution to Alliance for the vaccine work we were doing. It was through a program that was called the Collaborative Approach to Public Goods Investment, or the CAPGI methodology, which really was a group coming together and understanding there was a need, an immediate need to help our community, and that need was that COVID vaccine. The next contract that we had was with Eddy Senior Care PACE, and that was a 1-year contract on auto renew that really worked with those 3 levels of food services that I was just talking about: traditional food pantry, medically tailored meals, and home delivered prepared meals. The next contract was with the Innovative Health Alliance of New York. It was a subcontract for Fidelis value-based program, and it was really connecting individuals with chronic conditions that had not seen their primary care physician within 6 months or greater than 6 months. And there was efforts to outreach by social care organizations to try and get those individuals to come in and see their PCP. The next one we had was with MVP. It was a 2-year program where it was really a Healthy Together optimization program, or HITOP as we called it. And it really brought 7 social care organizations together to use Healthy Together as a referral platform to implement social care programs that improve the overall health of the community. And the last program that we had with MVP was a 1-year program that was cooking classes, which was for MVP staff, MVP Medicare Advantage, and members of the community. And one thing that we really just learned about programs such as cooking classes is it's so much easier for individuals to see what they need to do and how they need to cook things or prepare meals. Sometimes getting a recipe seems very overwhelming, but just to have the ability to look at what needs to be done, how easy it is to achieve that goal, it really is quite beneficial to individuals. Next slide. So this is a slide that I really love because it really is bringing everyone together. So the IPA network, let's just talk about that being on the outside. And then inside, in lockstep, we have a lot of things working on a conveyor belt. And I think that the way that this slide looks is truly the way that it works sequentially. And that's the beginning is screening for the needs, identifying what that person or individual needs, and really just starting with the referral process. Once that referral is made, there's an ability to look at the cases and look at the services and see what might be needed additionally. And then that resolution rate that I was talking about. The whole point of closed loop referral is to make sure that we really are following those individuals, following those referrals, and making sure that those services are rendered. And when they're not, we're having conversations and coming together to work to achieve a common goal. And the thing that is right in the middle of that is that patient-centric approach, really. So if that goal isn't being met or we're not able to resolve the case, we're really working with partners to see how we can resolve those cases. And then there's an opportunity to really look at health outcomes and what improvements are we making based on the fact that these social care needs are being met and these services are being achieved. Does that have a positive impact on health outcomes? And I think that based on everything that we know, it definitely does have a positive impact. So recognize the needs as it relates to social care in your community. It really is important to look at the needs of your community and really define community. Really, it's not just the macro, but it's also the micro, right down to the zip code. And connect and align with your mission, with community health organizations within your community. Identify opportunities to work closer together, to have a referral network, wraparound services, and do kind of a plan, do, study, act. Here's what we have, here's how we're working together. Is it working for our community, and what else do we need? You know, by addressing social determinants of health with our community, it's essential to convene with community-based organizations. It's connecting and convening with our community-based organizations that helps make us successful. You know, and understand the unique needs within your community. And again, I'll drill down right to zip code. You know, 2 miles apart, there could be differences. And what are those differences? But more importantly, what are those needs? And then through the screening process, reviewing the community needs assessment, we learned that housing and food insecurity have a direct impact and is tied to health outcomes, as you can well imagine. So as we engage with CBO, community-based organization during district efforts, we have expanded our CBOs into our IPA network. And we recognize that CBOs really have the ability to offer a variety of services that mitigate crisis, but more importantly, really offer security and stability. Next slide. So goal setting. I mean, it's always important to set goals and set targets to see, you know, how you can move things forward. So those SMART goals, specific, measurable, attainable, realistic, and time-based. But really, it's really to just understand what services do we need? What type of people how many people do we need to serve? How are we going to hit our goals? Are we going to think about that monthly? Are we going to think about that quarterly? What are we doing to review and making sure we're meeting those goals? And what are we seeing our community needs in addition? And what are we doing to meet those goals to make sure we can give our individuals or our members what they need with the community? And then where are the gaps? That's extremely important. Where are the gaps? How were they identified, and how can we close those gaps? Use data to demonstrate your effectiveness. What strides have you made? What areas do you still need improvement on? And what are you doing to really kind of move things forward? And who is it going to take actually to move things forward? And work with your partners on individual level to learn how they are succeeding and where they're stuck. And really understanding, when they're succeeding, share that. What's their best practice? And when they're stuck, really, how can we become unstuck effectively? And then challenge yourself to move the needle higher than your initial goals. That's always important, because I think that what we do is we set our goals, but I think that when you're working together and you have the right people in the room and the right organizations together, that you probably can achieve more than you ever dreamed of achieving. Next goal. So there needs to be an ongoing review of your network referrals. Really, if you're having referrals, who are they to? And if they're out of network referrals, why are they out of network, and how can we get them in network? Continue to seek community engagement and seek new partners. And really continued efforts to close the funding gaps for CBOs to expand on services. A network must continue to meet your needs within the community. COVID shined a really bright light on that for folks. And really, we needed to address health disparities, getting critical services to our most vulnerable population, and to make sure no one was without basic needs. And you should continue research and really just of your population and healthcare transformation. Reviewing services and recognizing who is and is not still being served is essential. So effectively, what we do is try and collect data that's consistent, and it's across the network, and we safely, and what we ask our partners to do is really submit data to Healthy Alliance to fulfill their contract obligations that they may have. Yep. And the next part is the benefits of staying together, connected. Interconnectivity is a big thing. When we always think about how our systems can talk to each other, It's kind of expensive and it's kind of a barrier. With the Unite Us platform, it's wonderful that we can connect without having to be connected by systems, but we can actually leverage a system to be able to communicate to each other. The closed loop referral system is something that not only can connect the community, it also can pull data about the community and drill down to see what we need in terms of even down to zip code. And it really digitally bundles social care providers together. Ensure that the volume of and the quality of referral goals are met, really just making sure that referrals are sent, they're being received, they're being worked. And if they're not good referrals, if someone doesn't want to be engaged, why don't they want to be engaged? Do an analysis of the data. And you're able to do that because it's your data. And then leverage the resources needed for value-based program requirements. So for our team, we provide ongoing, you can have ongoing support and leverage the experience of the Healthy Alliance IPA team. We have social care navigators. Once the referral is made, they catch that referral and they really track it and make sure it's closed. And if it's not, you'll hear from them. And then also we have a performance management team that really can share with you the data regarding your organization. That's a great help because you can really kind of use the support of a team that can really pull that data and just come to you and show you what's going on within your organization. So really, I think, the value proposition really breaks down to improved health, social care data, social care tools, and member-centric. So improved health is really the reduction of social care admissions. It's the reduction of total cost of care and the improved quality of care. Social care data is visibility to member-centric data and really standardized social care needs and services. It's for whole person care, and it really can highlight what is needed: food, housing, transportation, benefit navigation. Social care tools, we have screening tools that could be shared with anybody. We have appropriate referrals using closed loop referral system and making members sure they don't fall through the cracks, which is the most important part of all of this. And then just member-centric, really improving those HEDIS and CORE scores and member satisfaction. If you have any questions, I feel like there was a couple of questions that may have come up, and I'm certainly happy to answer them, or Kashana can answer them. Andrea, maybe you want to share with us any questions that were addressed.
Sure. So please, whoever has questions, please add them into the chat box now. We do have time. A couple comments rather had come through. Someone had commented that in Hamilton County, they were unaware of any agencies carrying out SDOH evals except for government agencies, such as county nursing. And then there was a response that health home clients have an SDOH eval as part of their assessment, which is typical for care management programs. It was noted that AHI is the lead health home and works with 25 downstream care management agencies that are offered in Hamilton County as well. So just some clarification there. This was a really fantastic presentation, and I would encourage, if anyone does have questions, to add them to the chat box. And Julie and Kashana, I'm not sure if you, your contact information is right there. So if anyone does have questions, you have Julie and Kashana's contact information to reach out to them. I don't know if either of you saw any questions come through on your direct chat boxes. I know that has come up a couple of times. Anything on your end that came through?
No, I think I agree with you in seeing that there was just a couple of comments made, and I agree with those comments. So yes.
Okay.
Not on my side, but I will add to that comment too, as it relates to Julie's point on reassessing your network. That's something that we continuously do. And even just based on the comment that was in around Health Home and other government agencies, you should include them in your strategy as well in terms of creating that integration between your organizations as well. So when you're reassessing, definitely look to see like who else is also connected to this space, wanting to address social determinants of health, or maybe kind of one of those barriers to getting your consumers connected because you want to include them in your network as well. But it's continuous improvement for sure, like is to continuously see like, do we have gaps in services? Do we have gaps in connections in terms of benefits navigation? Possibilities are definitely endless, but the nature is just to keep at it, keep looking, keep reviewing, definitely engaging community-based organizations, consumers as well, to get a feel for what are the true needs and making sure that your network is able to be as responsive as possible.
Thank you. So I would say if we have no other questions, I think we can wrap up. I would like to thank Kashana and Julie for this fantastic presentation. It was very informative. And again, I encourage anyone who's in attendance to reach out to them directly if you do think of any questions after the fact. And thank you again for the presentation. Thank you for all who attended. And we hope to see everyone later in the week for the remainder of Summit. Have a good evening.
Thank you.